Sorry, say it again.
Working?
Say it again.
Okay,
Sorry.
no problem.
It was really good.
Yes, good afternoon. My name is Chad Lamson. I'm the clinical nurse educator for the South Atlantic Division of Biotelemetry, specifically the BioTel heart side, so outpatient cardiac monitoring devices. We also have a research division that follows other people if you need to do research. And I'll tell you a cool one with that we're doing at Duke with Allergan and injecting hearts with Botox. But the reason I'm here today is WakeMed Hospital System has decided to go with biotelemetry for all their outpatient cardiac monitoring. Biotelemetry is now LifeWatch and CardioNet companies joined together, so Holter monitors and live event monitors, along with a platform called Geneva, which allows Epic system users to monitor all their implantable and wearable devices in the same place, no matter what company it's from. So Abbott, St. Jude, Medtronic, Biotronic, BioTel, all the reports and data that come in from device clinics are all integrated within Epic. So that's the reason that WakeMed went to us. Then we also have the best products. So from a clinical standpoint, what you'll need to know is we do the 4 categories of patients. Traditional Holters, which are 24, 48-hour Holters that are just a looping recorder that records data. The patient brings the monitor back to us or to the clinic. We download the data, the doctor looks at it, and then decides what they need to do for treatment. Extended Holter monitors, which can be worn up to 14 days, that are still a Holter monitor, so it's not live, it just records data for 14 days. The patient brings it back or mails it to us, you get a report at day 21. Those are patients really that you just need like an AF or PVC burden on, that you're trying to titrate medications, or that are asymptomatic, that you're not worried about having syncope or any kind of malignant arrhythmia. Those are the patients you want to put on those 2 devices. The last 2 categories are live devices, so there's an event telemetry mode and a live telemetry mode. So depending on those 2 monitors, if you have a malignant arrhythmia that you're worried about them having syncope, hitting their head, getting intracranial bleed, you want to put them in a telemetry mode, which will record every QRS, P, T wave, and we compare each one to the next one. So you get the best morphology from those type of patients. You also get the AFib burden, PVC, and PAC count, since that monitors the patient live 24 hours a day for the 30 days they're on it. The event mode of the same monitor is for patients that you suspect have benign arrhythmias, but you still want that live data. So they can still record symptoms, we'll still watch for AFib, we'll still watch for trigeminy, all those things, pauses, but it doesn't record for the full 24 hours. It only records when they're symptomatic or when we see one of those events at our tech offices on the East Coast in Virginia or Pennsylvania. So the monitors themselves that you guys will see, what happens is doctor sees the patient or nurse practitioner see the patient. They decide that they need a monitor because they came in with palpitations or syncope. You'll decide if it's a malignant arrhythmia or benign arrhythmia and what device they need to be put on. And you'll put it in an order set. The patient goes down to the heart center, where the nurses and MAs down in the heart center register the patient with all their information for now until we get integrated with Epic. And then they pull a device out of the drawer. So all of our devices use a sensor that is the same for every device, depending on what the doctor orders for it, and a modality. So you can wear it as a patch form or a lead wire form. So the patient orders it in a telemetry form. The nurse practitioner, MA or nurse, gets this box, because this is a Holter monitor, it does not come with a cell phone. All it does is records looping data for the amount of time that the doctor ordered it for. And you will place it in the patch, put it on the patient, and it'll record their data for 14 days. Comes with a couple extra patches in case they get sweaty or if it falls off, or if they're a swimmer. This can't go in anything in water under 3 feet, so not to wear it in a hot tub or bathtub or swimming. But it can go in the shower, it's waterproof. They can wear it. The patch itself is made by 3M, so it's a Tegaderm material. So as per manufacturer's recommendations, they only wear it for up to 7 days, and then take it off, let their skin dry, and put a new patch on so you don't build up bacteria under the dressing. In the live telemetry mode, the box will be a little bigger. It comes with extra patches since they wear it for up to 30 days, and it comes with a cellular phone. So this is always sending out Bluetooth information to the cell phone, and the cell phone is sending it to a tower so that we can see it in near live time. The patient can record symptoms on here, so if they're lightheaded, short of breath, if they had a syncopal episode at school and a friend can push it, or when they wake up they can push it and record it. That'll mark a strip for the doctors, and then they get those reports within 15 minutes of having the event. If they are asymptomatic, but we see the event, same process happens. Our techs will call over another tech to verify that they were in new onset AFib. Dr. Wayne will sign off on it as a preliminary report, and then he will send that to Dr. Allen or whoever's in the group. They'll get a report that looks like this, a daily event report for whatever rhythm that patient was in at that time, and then they can make the diagnosis if they want to bring the patient back into clinic to start them on medication or get them on a list to have an ablation or whatever they want to do with that diagnosis.
Is it sent to the doctor who orders it?
This, so it's always enrolled under the doctor of the day, whoever the,
Oh,
whatever you call it downstairs. So the doctor of the day enrolls all the patients today, and then it also puts in the reading doctor, so whichever doctor is going to follow up with it. So if Dr. Fafari in Clayton has a patient that's here in the heart center that he wants to have a monitor, they go downstairs, get registered under Dr. Allen for the day here for coding and billing. But then the reading physician is put under Dr. Fafaria so they can follow him up in clinic there.
So how is this gonna be an epic for us, the way for us to designate that, do you know?
So that's still like 4 or 5 months, and before the Epic team figures all that out, I'll make sure to in-service everybody again. But it will all be just under your normal order sets. It'll populate the patient's name and what device you want. This is kind of a sample algorithm of what they're looking at to put into Epic, so you'll know how to order the device and where it goes to. But that is still like 4 or 5 months off. They told us probably September.
So how are we supposed to order these now?
we're doing just plain event
Event
monitors
monitor?
like
Yes.
we've been
And then
doing,
just put how many days, whether we want a Holter.
like we always do.
So we don't order the old Holter and all that stuff now, we're just ordering straight
Event
monitors?
monitor, I think is, and
Yes,
just the
most of them are
duration.
event monitors. Unless you're trying to titrate some drugs, the patient's already asymptomatic and you're just looking for a burden of the patient for 24 or 48 hours, then you order a holder. Otherwise, everything else is an event monitor. The doctor gets a daily report on the event monitor that looks like this, so it's gonna give them average heart rate, highs, lows, any events that happened in the last 24 hours, and then something called Somnet, which is a sleep apnea indicator. So if a patient has that on their chart for any given amount of time, plus they meet the other 2 criteria to have a sleep study, like they snore and they're overweight, then the doctor can use this to order a sleep study on that patient, because that may be what's causing their AFib or arrhythmias. And then that really is the Cliff Notes version of what it is.
Okay, so
What
getting the
questions do you have?
information, like I had that patient, that's how we got in touch. A patient has it coming in, is there a particular number, or should we just take your number like I did before and give it, and call you? Because the nurse had no idea, you know, it was the primary doctor's nurse. Whitney said, okay, Jessica's Dr. Marich's nurse at that time.
Right.
And she has to look it up. But Dr. Allen made the very good point that, okay, so say this was ordered by Dr. Silver to read into place as the doc of the day, but he's away on vacation.
Yes.
So it could go to into a box and nobody see it, and Dr. Allen wants to make sure we see this.
Right, so any reports that come in go to the same fax number to the hospital now. So the reports come through live through a fax, no matter if the doctor's here or not here or whatever happens.
Where is that fax?
It's gotta be in the office somewhere.
Yes, I think it's on the north or south side of the nursing stations in the corner.
And it comes in within that 15 minutes, like you said?
Yes, urgent or emergent reports.
Okay, so we need to find out.
Daily reports come in through the web portal for whichever nurse or nurse practitioner pulls up that doctor's reports. And those are for the whole WakeMed system. So no matter where you float or where you're at or where your doctor is, the whole WakeMed system is on that report. So the nurses can filter it out by their doctor of the day who they want to see reports on. But if they wanted to, they could click on all 38 cardiologists and see all of their reports.
Can you filter it by patient name?
Sure. Patient name, date of birth, or provider.
How do we
Can
access
we get access
those
for
to the
this?
portal?
Yes, so I could get you access.
Please,
They just,
all of us.
When we set it up, all the practice managers gave me the names of staff that they wanted to have access to it, but I can approve anybody else to have access.
Yeah, especially because we're inpatient, and if a patient's wearing this and when they come in, we can just go into the portal.
For sure. Yeah,
And
you can
find
pull the
out,
report right away
instead
and
of
it'll
trying
show
to
you all
chase
the-
down a fax.
So maybe we
And the
shouldn't
portal-
have everyone have access,
Uh-huh.
like certain people, like I think all the EP people, and I think 2 or 3 night shift people that,
At least, but there's gonna be a day that I'm not here and Aaron's not here and Chris is not here.
So,
well, I know, but, you know, I mean,
well, if
Yeah.
most of us have it.
The
I'm just
portal,
saying-
we can get the daily reports,
Sure.
but what about the information that would have been in the fax report for the urgent report? Is that on the portal?
That will be in the portal as well.
Okay,
Yep, so, the way that it works is, when they see it and Dr. Wayne, clears that it truly was an 8-second pause with, you
hey,
know,
this is
by
Christy
Gemini
with
or whatever.
cardiology, I was
They
asked to
fax it
page for a
first to you
callback.
guys, then they try to make phone calls to, if it's an emergent, they call the patient and the doctor of the day, or whatever number that they set up here for the reporting system.
I'm sorry?
Until they can get somebody on the phone. So they'll call the patient, the phone
Yeah,
number
it's,
unfortunately
I'm
comes from
at,
either Virginia or Pennsylvania.
I don't
wherever
even
the
know,
tech
do
is.
you guys know the extension here?
5269.
5269.
sorry,
So some patients don't answer the phone thinking it's a telemarketer.
right,
But it always comes through to like Aisha or Sherry, whoever sits at the nurse's station of the day, and
Right.
they get it live.
right, but at 6 o'clock, when I have a patient hit the ER who's syncopized and
Yes.
is wearing one of these, and I wanna see what's happened to them in the past 2 hours.
Right. No, you can pull it up on the
Okay,
portal.
Portal.
so it doesn't have to wait for a physician to sign off on it before
No.
I can see.
We post it, and it will say preliminary report, unable to contact physician, or sent via
Okay.
fax, or something like that. So the new algorithm is they always post it first, no matter what.
Okay,
So we don't
And
have
they
to
start
get in touch
trying
with
to
Dr.
contact.
Wayne or anyone else?
No,
Okay,
we'll post it, and then
We
the
need that
text will
portal.
say,
Mhm.
you know, unable to contact nurse, left number, you know, voicemail on this phone number, whatever. But it'll be posted for people to see.
okay.
okay. So we just need to get access to that portal.
Yes,
Could we
so
have
the
it
only
with?
thing I need is someone from the group on a WakeMed email account to send me a list of names and emails that you want to have access, and then I can get it approved. I can't give access myself.
So you have my email. Just send me your, I will send you, I already sent it to everybody, and I'll send you an email that'll have everybody attached to it, and it'll have all their
Yes,
emails.
perfect. If you say, please
Yeah.
give access to
Portal.
the staff in this email,
Yeah.
then I can do that.
Perfect. Okay, and then we'll all have it. And I will copy, if I may, that information sheet that comes with it, so that people can have an idea of what the
reports?
paperwork, the
Yeah, for
report
sure.
looks like.
So these are the live reports, one version of each. So a daily summary, the urgent, and then an end of service that they get after the 30 days.
Okay,
This one would be the Holter monitor report. So if they wore a Holter monitor, this is what that report looks like.
Okay.
Those you wouldn't be worried about. Those, if they came in anyways wearing a device, you wouldn't see any data because it's just a recording device. It's not live. So we would need to download it first before you would see anything. So nothing on those kind of patients would show up.
and those, when they wear them for 30 days or 14 days, they're all mailed back to you, correct?
Yes, because we need to clean, so the phone has all their HIPAA information on it, so when it's sending it to us, we can see who it is. So we need to get the device and the phone back so we can clean it all up and send it out to be reused again.
Now, I had, the patient that had it on, it was a short one, so it was probably like a 14-day one, cause it didn't have the leads. And
They
he,
don't have to,
so it can be a
option
30-day
comes
with that as well.
They can wear, depending on the patient.
Okay.
So, my recommendation as a clinician is, any patient with a suspected arrhythmia or that you're worried about, always wear the lead wires, just because this is true V1, V3, you get a cleaner picture of all the stuff you're looking
Okay.
for. Right? For patients' ease, patches have come out the last couple of years, which I hate, but I understand. So they can just wear this for 7 days and not do anything with it, right? So it's easy for a patient to wear this, but as a clinician, you only get lead V1, modified V1, and then a subset of that, right? So it's all one angle, and you don't get as clean a data.
And both have the phone with it.
Both event and live telemetry have the phone with it.
But the patient
Holters do not.
that I
That's just an
had-
Old traditional holder used to wear in a big box with
Yeah.
a bunch of D batteries.
patient that
Now
I
it's
had
just-
in the ICU, confused, he could never have done the telephone. So where he was staying at rehab was doing the phone? How was that?
So the phone yes, whoever he was staying, the phone has to be within 30 feet of the device to be able to send data. So a patient could wear this, leave the phone at home, go to the grocery store, come back, and when it's Bluetoothed again to the phone, then it sends all the data.
Right, I mean, there's things that you have to do, but if you want to document symptoms,
Yes.
you have to interact with the phone.
I was
Yes.
Yeah.
You have to hit the
given
phone.
your name to
You
call
can
regarding
double
Mr.
tap
Crawford, I think.
the patch, and it will just put a mark on the strip, but it doesn't say, I was lightheaded, I was dizzy, I was running, doesn't give you activity levels.
Good to
It
know.
just puts a mark.
Good to know.
So you really want the phone because when they hit that they're having a symptom, it
I
asks
don't-
them all those questions.
Well,
What
I
are you
don't know
doing
anything
for
about the
activity?
patient,
Is
but
it
I read,
light,
Dr.
moderate,
Mufari
heavy?
has
Are
signed
you
up on
running?
his,
Are you
signed
watching
his
TV?
note
Okay.
around
'Cause that's really what we
12:30
wanna know as a
and maybe
clinician
he needs
is,
a,
You know,
yeah.
I just got done
So,
running, they were
um,
playing soccer for 90 minutes, and now I'm,
He
Yep,
having,
okay.
signed.
All right,
the
anything
note
else,
from the
girls?
night, PA.
and you can text me or call me for anything. I live right off of
Your phone number?
I'm sorry, I'm not.
Your phone number?
it's not near,
919
the computer. I stepped away from it,
0559.
Great.
So, I mean, you can see it in
An
the-
email?
under his signed note, and I'm guessing just to make
Chad
sure that this guy's okay
Lamson,
for surgery.
Lamson at
Yeah, I mean, he's had a
gobio.com.
recent stent from what I read, so, you know, we recommend continuing the